Hi there. So today I'm going to be giving you an overview of heart failure. And we're going to abbreviate that HF for the rest of the time. So what we're going to talk about are some common definitions to clear up any confusion. We're going to go a little bit into the epidemiology of the disease. And finally, we're going to talk about some of the classic symptoms that are associated with heart failure. So the first order of business is going to be to distinguish between heart failure and congestive heart failure. Now, this is a source of confusion for a lot of students, and the terms are commonly used interchangeably in the hospital setting. So for the purists out there, let's see if we can make a distinction between the two terms. So heart failure is any condition that results in a decreased ability of the heart, which is the pump, to either fill with or eject blood. The heart is a pump. It needs to fill with blood and then eject that blood to the rest of the body. So the difference between that and congestive heart failure is that congestive heart failure is really just a term that describes some of the symptoms that accompany heart failure. And so this is really heart failure, as we just defined it, plus signs and symptoms of volume or fluid overload. And so when the heart can't fill or pump effectively, you get a backup of blood, and that puts you in a state of volume or fluid overload, and that's also known as congestion, hence the name congestive heart failure. So the next thing that we should talk about are common types of heart failure. And so the medical community commonly breaks down heart failure into systolic heart failure and diastolic heart failure. And you've probably heard these terms systole and diastole used when referring to blood pressure. So if you've taken someone's blood pressure recently or gotten your own taken, let's say the reading was 120 over 80. Now this is in millimeters of mercury. The 120 is the pressure at which the left side of the heart pumps out blood to the rest of the body. And the 80 is the pressure that's left in the body when the ventricle is relaxing and filling. Okay, and so if you have a problem with ejection, this would be a systolic heart failure. If you have a problem with filling, this would be a diastolic heart failure. And so the last thing that we should talk about is just the difference between right-sided heart failure and left-sided heart failure. And if you'll notice, when I was just talking about systolic and diastolic pressure, I was alluding to the fact that this is the left ventricle that's pumping out. And most of the time, that's what you'll hear. Most of these terms are related to the left ventricular function. But right heart failure is important in its own right and can cause its own set of symptoms. And so the big difference between these two sides of the heart is that the left side pumps out to the body, or what is known as systemic circulation, and the right side of the heart pumps out to the lungs, or what's known as pulmonary circulation. And it's important to keep right heart failure in mind because the most common cause of right heart failure is left heart failure. So let's move on to some of the epidemiology. So what I've done here is listed some common parameters that people use when they describe a disease, and we're going to go over what the meanings of these words are and then fill in the values for heart failure. So prevalence is the number of existing cases of a disease. Incidence is the number of new cases of a disease per year. Mortality is the number of deaths that result from this disease per year, and cost is pretty obvious. So there are 5.1 million people in the United States with heart failure. In addition, there are 670,000 people that are diagnosed every year with this disease. And of the people with heart failure, 56,000 die per year. And finally, the cost to our country's medical system is a whopping $32 billion. Now you can see that this is a relatively common disease and has a huge economic impact on our country's healthcare system. So let's move on to some of the most common symptoms that are associated with heart failure. So what I've done here is made an outline that we're going to fill in about how blood flows through the body. And then what we're going to do is show you how problems with the left side versus problems with the right side will give specific symptoms to whatever side is affected. Okay, so let's get started. So blood is going to come from the lower limbs and the liver and GI system, and the head and upper limbs into the right atrium. And this is deoxygenated blood. That blood is going to then go through the tricuspid valve into the right ventricle. From the right ventricle, blood is going to be pumped out to the lungs, okay? And here are your lungs right here. And the lungs are going to oxygenate the blood and bring it back to the left side of the heart, the left atrium. From the left atrium, the blood is going to pass through the mitral valve to the left ventricle, and from the left ventricle out of the aorta, which is the largest artery in the body, to the rest of the body and vital organs that need oxygen to carry out their daily functions. So if the left ventricle fails, blood is going to back up from where it came. And so this means blood is going to back up in the lungs. So what you see in people who have left heart failure is dyspnea, which is a fancy word for shortness of breath. And normally, this will start out as dyspnea on exertion, meaning with exercise, because the heart can't keep up with the body's need for oxygen. As the disease progresses, this generally can occur at rest as well. You will also have a cough, and this is normally a dry cough, and that's because fluid is escaping out of the vascular space in the lungs where it's congested and compressing the airways. Now, if you have a very large and rapid fluid overload in the lungs, that fluid can actually get into the air spaces, meaning that you'll have a cough productive of pink, frothy sputum, and those are kind of buzzwords for an acute pulmonary edema. Okay? Another thing that we should talk about is orthopnea. And this means shortness of breath when lying down or in a recumbent position. And what happens is because blood normally pools in the veins in the lower extremities due to gravity, when you lie down, that blood then comes back up to the heart and kind of overwhelms the left side of the heart, and so the lungs become even more congested and you get shortness of breath. So the last thing that we should talk about is PND, or paroxysmal nocturnal dyspnea. And this is a shortness of breath that occurs at night, usually 2 to 3 hours into sleep of a person with heart failure, and they wake up basically having an acute asthma attack. And the mechanism behind this is not really known, but some people attribute it to a reabsorption of excess fluid while you're sleeping that will then come back to the venous system and overwhelm the heart, much in a similar way that the orthopnea occurred, except this fluid that's being reabsorbed escaped out of the veins. So now let's talk about right heart failure. If the right heart fails, the blood is going to back up again from where it came, and so you're going to have higher pressures in the venous system that led the blood there in the first place. And so a lot of times when those high pressures occur, you can get fluid that goes out of the vascular space or the veins and into tissues. And when it does this, it usually settles in places that are dependent upon gravity. So what you'll see is people will have swollen legs and swollen feet, and this is known as peripheral edema. Okay, and so the other thing that happens here is because the blood from the gastrointestinal system goes through the liver before it gets to the heart, when that blood backs up, it'll also back up into the liver, and so you could get an increase in liver size, which may make some of the patients complain of abdominal discomfort, and if that pressure builds up enough, you can also get fluid out of the vascular space and into the abdominal cavity, and this is known as ascites. So I hope that by watching this, you've gotten a general overview of what heart failure is, how the medical community categorizes some of the different types of heart failure, how much of an impact this disease actually has on our country, and some of the symptoms that are commonly associated with heart failure.